Hello, everyone. Thank you for joining us. I'm Steve,
I'm Scott.
and together we're Backyard Musings. We're the Science and Technology channel. I want to wish you a good morning. Yesterday, fascinating topic about the Searles Lake.
I want to just reiterate that I appreciate that topic because I love being able to put a location or a face to a story like that. So it's cool. This is
All
cool
right,
too.
a study at Mount Sinai has shown that children with a high tolerance for peanuts can significantly increase their resistance to allergic reactions by consuming controlled increasing amounts of peanut butter over time. This approach, safer and cheaper than current therapies, suggests a major shift towards personalized allergy treatments that could revolutionize how food allergies are managed, building up a resistance to allergies. The research, funded by the National Institute of Health's National Institute of Allergy and Infectious Diseases, was published in the February 10th issue of NEJM Evidence. Would you like to know more?
Children with high threshold peanut allergies who gradually increased their intake of store-bought peanut butter became significantly more desensitized than those who avoided peanuts, according to a new study from the Icahn School of Medicine at Mount Sinai. The study found that this approach led to higher and longer lasting tolerance levels. The standard approach to managing food allergies has been strict avoidance, but in recent years, peanut oral immunotherapy has emerged as an alternative. This treatment involves gradually increasing daily doses of peanut protein under medical supervision to build tolerance.
So that's the key there, under medical supervision. So don't run home and try this and on your child or grandchild. Do this with medical supervision.
So
Okay,
no,
quote.
you're saying don't go grab a bag of peanuts and then have a bag of peanuts in one hand and an EpiPen in the other and give it a shot, huh?
Well, they said store-bought peanut butter, so it would be like Skippy or some brand
Okay,
like that. Yeah, don't, no EpiPen. Yeah, under medical supervision. Okay,
gotcha.
here's a quote. Our study results suggest a safe, inexpensive, and effective pathway for allergists to treat children with peanut allergy who can already tolerate the equivalent of at least half a peanut. Considered a high threshold peanut allergy, said Scott Seacher, medical doctor, director of the Elliott and Rosalind Jaffe Food Allergy Institute at Mount Sinai Kravis Children's Hospital, chief of the Division of Allergy and Immunology in Mount Sinai's Department of Pediatrics, and lead author of the paper. Wow, this guy, he's pedigreed, definitely.
He needs two business cards.
Yeah. Quote, our findings open the gateway to personalized threshold-based treatments of food allergy and will encourage additional studies that delve deeper into peanut and other foods for this approach that might be a game changer for the majority of people with food allergies, end quote.
However, previous studies leading to FDA approval of peanut allergy treatments, both at injectable, biological, and an oral immunotherapy, have primarily focused on individuals with extreme sensitivity, reacting to as little as a half a peanut or less. Uh, I just can't understand that. But anyway, in contrast, an estimated 800,000 children in the U.S. have a high threshold peanut allergy, meaning that they can tolerate at least a half a peanut. This study specifically explores whether these children could benefit from different treatment approach. I I have a grandson that's got a peanut allergy, and he's not purposely, but he's accidentally consumed some food that has had peanuts in it, and fortunately, not had, from what I gather, from what I understand, not had a really huge allergic reaction to it. But they carry the EpiPen, and and they've been quick to take him to like an emergency room. You know, if he knows that he injects peanuts, so they're real careful. But I would love for him to be able to get over that allergy. So
Yeah. All right, here's a quote. Years ago, when people with milk and egg allergies were advised to undertake strict avoidance, Our team initiated studies that found most people with milk and egg allergies could tolerate these foods in baked goods, which changed the global approach to these allergies, end quote, said Julie Wang, another medical doctor, professor of pediatrics at the Icahn School of Medicine, clinical researcher at the Jaffe Food Allergy Institute, and senior co-author of the paper. Quote, the research team recognized that more than half of people with peanut allergy can tolerate half a peanut or more, and thought that this group of people might be treatable if we took a different approach to peanut oral immunotherapy. We were thrilled to find that this treatment strategy was even more successful than we had anticipated, end quote.
To test this hypothesis, the study team recruited 73 children ages 4 to 14 years old. Study participants were assigned at random to either test the new treatment strategy or continue avoiding peanuts. The children in the peanut ingestion group began with a minimum daily dose of 1/8 teaspoon of peanut butter and gradually increased their dose every 8 weeks over the course of 18 months. Wow, that's a long study.
Yeah.
Ending at one tablespoon of peanut butter or an equivalent amount of a different peanut product. All dose increases took place under medical supervision. None of the study participants in the peanut ingestion group had severe reactions or needed an epinephrine during home dosing, and only one received epinephrine during a supervised dosing visit. So that's pretty promising right there.
Yeah, that is going from an eighth to up to a 1 tablespoon in 18 months. Following the treatment regimen, children from the peanut consuming cohort participated in a feeding test, carefully supervised by the study team to evaluate how much peanut they could eat without an allergic reaction. All 32 children from the peanut consuming group who participated in the feeding test could tolerate the maximum amount of 9 grams of peanut protein, or 3 tablespoons of peanut butter. By contrast, only 3 of the 30 children from the avoidance group who underwent the feeding test after avoiding peanuts for the duration of the study could tolerate this amount.
Because the trial took place during the COVID-19 pandemic and some families preferred avoiding close encounters indoors, some did not return to the study site for the feeding test. That's too bad.
Yeah.
Using a common statistical technique to account for the children who missed the feeding test, the team reported that 100% of the ingestion group and 21% of the avoidance group tolerated an oral food challenge that was at least 2 doses more than they could tolerate at the beginning of the study. So that's pretty promising.
That is. To test if the response to treatment was durable, children in the peanut ingestion group who could tolerate 9 grams of protein, remember that's 1 tablespoon, during the feeding, or was that 3 tablespoons? Yeah, during the feeding test, went on to consume at least 2 tablespoons of peanut butter weekly for 16 weeks, and then avoided peanuts entirely for 8 weeks. 26 of the 30 treated children who participated in a final feeding test after the 8-week abstinence period continued to tolerate 9 grams of peanut protein, indicating that they had achieved sustained unresponsiveness to peanuts. The 3 participants from the avoidance group who could eat 9 grams of peanut protein without reaction at the earlier food test were considered to have developed natural tolerance to peanuts. A comprehensive analysis of data collected from all 73 study participants revealed that 68.4% of the peanut ingestion group achieved sustained unresponsiveness, while only 8.6% of the avoidance group developed a natural tolerance.
So this is a quote. These study results are very exciting and a huge step towards forward in personalizing food allergy treatment, concluded Dr. Seiterer, the Elliott and Rosalind Jaffe Professor in Pediatric Allergy and Immunology at Mount Sinai. That guy likes to talk about his bona fides.
Pedigree, yeah.
Yep. My hope is that this study will eventually change practice to help these children and encourage additional research that includes this approach for more foods. In addition to expanding the work to more foods and validation studies of their approach, the Mount Sinai study teams aims to determine a better way of identifying individuals with higher thresholds, because the best way to do so currently requires a feeding test that is bound to cause an allergic reaction. So again, I wish I have other family members that are allergic to. I mean, the lists are as long as your arm, and I don't know how they get through life like that. Like we talked about,
Very
eggs,
carefully.
milk, and bread, and but we don't have to talk about it now. But I've known some people that have gone to some doctors, and they've been able to get through these allergies. Some of them peanut, some of them gluten, some of them animal hair, and it's fascinating to me. I don't know why the more people don't try to take advantage of that. So I'm all for these kind of studies. I don't ever remember. Do you remember anybody growing up when you were a kid and it being allergic to peanuts? I mean,
Nope.
if they had, they would have been stabbing themselves every day. Because I mean, the go-to food in a brown paper bag from home to me was peanut butter and jelly sandwich.
Yep.
I mean,
We send that Cameron, that's his main lunch, peanut butter and Nutella or peanut butter and strawberry jam.
does the school give you a bad time about that?
No.
They don't. You don't have to have. Okay, well that's cool.
Well, he can choose to eat the school lunch if he wants, but we send him with, homemade
Well, no,
stuff.
I'm just talking about the other kids being there that possibly are allergic to peanut butter or peanuts. That
They probably identify that and then separate them out.
Gotcha.
Yeah.
All right.
All right, folks. Thanks for
Good
joining us.
story.
We hope this helped you. Give us some comments if you know anybody who's benefited from increasing their doses and overcoming their allergies.
Yeah, I know some people that have wanted to do that with their kids, but at this point, I don't think anybody has taken that step yet. But I don't know. This is very promising. So we'll see how this goes.
Yep. See you later,
Take care,
folks.
everyone. Thanks.